Just over 1 million doses of the Johnson & Johnson vaccine ready to be dispatched. Phase 1 of the vaccine rollout will resume on Wednesday. The plan is to vaccinate about 5.5 million senior citizens. My colleague Heidi Jokos is following that story, joining us now from the newsroom here at ENCA. Heidi, good afternoon. Welcome to the Midday View. Now, online registration should have started a few days ago. I wonder how that has been going. What do we know?
It seems as though it has going reasonably well, given the fact that almost 500,000 people have registered on the online vaccine system. We know it went live just over a week ago. We also do know that there have been some glitches. About 100 people have asked for additional support on the system, and this was going to eventually happen, given the fact that people over the age of 60 are now able to register, and not many are tech savvy, not many have internet access or smartphones or understand how the portal actually works. But we do know that the project manager has indicated that vaccination centres are available for those who are unable to register on the system to walk into a vaccination centre or ask help from a local municipality with regards to how they can vaccinate and when their vaccination dates will actually be. So it seems as though the provinces that have registered the most people seems to be Gauteng, followed by the Western Cape and KZN. Gauteng, we have seen over 100,000 people registered for the vaccine, especially those over the age of 60. So it seems as though it's going pretty well, but let's listen to further clarity from the project manager on this vaccine data system.
Provinces has registered, and currently most of the registrations, more than 100,000, is in Gauteng. And then it's followed by the Western Cape, and then followed by KZN. And but we've got registrations based on our analysis in all the provinces, in all the areas, in all the municipalities, and so we've got good coverage in terms of the numbers that has been registered for throughout the country. We have got few and limited requests for support, which we have dealt with. I think to date I've received about 100 of individuals that asked for some information and clarity, but that's what we are aware of. Obviously, the provincial facilitating the rollout in the communities will have more information, and this is why we have implemented this program where the provincial departments of health will have specific targeted programs for assisting individuals to register, or for our elderlies to register on the portal.
Heidi, can you tell us a little bit more about plans being made for those people who currently cannot register online? I'm sure there might be some concerns about that.
Most certainly, especially in the rural areas in provinces where there isn't much internet access or people don't have access to smartphones. And we have actually been seeing some of our reporters speaking to senior citizens and the elderly, saying they're not entirely sure how to register. They don't know how the system works. It's a little too complicated for them. They're not as tech savvy. But what has happened is government is urging neighbours, family members in the community to assist those who want to register to do so, provide them with a cell phone and guide them through the process. But what's also key here is that there is an option on the portal called assisted registration. If you're having any issues, somebody will be able to assist you. But of course, we do know that government is mobilizing people on the ground to try and get them to assist those in remote areas that are unable to register, that aren't sure about this. But government is saying that those who are unable to register should not feel as though they are going to be excluded from the vaccine rollout. Instead, that they can go to the nearest vaccination centre, and the system is there rather to collect data, to collect the necessary information so that government can plan properly, so they can know on a given date they'll have 100 people coming in from a specific community to get vaccinated, so they are able to plan accordingly. Let's listen to what the health minister said with regards to assistance of those who do not have the means to register online.
The registration on the vaccination data system is not to exclude anyone, but it's just to record who has been vaccinated. So those who couldn't enter the system, we simply will announce that we are doing vaccination in these particular areas. Then they'll come through with their IDs, and we simply just register them and vaccinate them on the spot. Now, we have also said that most of the Johnson & Johnson is going to be located in rural areas because it's easy to store, it's easy to distribute, and makes it easy to give one person an injection. They don't have to, pay for transport twice to go to distant clinics and so on. So we think that it's going to help to cover the rural areas. We're focusing on the entire country, and we're going to deploy most of the Pfizer vaccines onto metropolitan and city centers where we know that there are many people that can be found within a shorter radius, and therefore it makes it easy to reach out to as many people as possible. It's easier to store them as well.
Thank you very much, the Heidi Jokos, with an update on that online registration process. Let's continue our